Which of the following bodily fluids does not transmit human immunodeficiency virus, HIV? A. Breast milk. B. Blood. C. Vaginal secretions. D. Semen. E. Saliva. The answer is E. Saliva. HIV is easily spread through all of the listed body fluids with the exception of saliva. A person may not contract HIV through exchange of saliva during activities such as kissing or sharing eating utensils. Which of the following regarding human immunodeficiency virus, HIV, is false? A. The risk of transmission increases in individuals who have another sexually transmitted infection such as genital herpes. B. In heterosexual encounters, it may be easier for a woman to contract HIV. C. The number of disease particles in a fluid is called the viral load. D. HIV can spread to other individuals starting 2 weeks after the host is infected. E. Healthcare workers have a relatively low risk of contracting HIV when using standard precautions. The answer is D. HIV can spread to other individuals starting 2 weeks after the host is infected. HIV may be contagious just days after the host is infected. Women in heterosexual relationships may become infected more easily than men due to prolonged exposure to bodily fluids. It is, however, possible for men to contract HIV from an infected woman. HIV is not frequently transmitted to healthcare professionals. Even for those who suffer from needle stick injuries, transmission is unlikely. Symptoms of acute human immunodeficiency virus, HIV, typically occur within how long after infection? A. 8 to 12 weeks. B. 1 to 2 weeks. C. 4 to 8 weeks. D. Greater than 1 year. E. 2 to 4 weeks. The answer is E. 2 to 4 weeks. Symptoms of acute HIV generally occur 2 to 4 weeks after infection. A vast array of symptoms may be present such as fever, rash, generalized fatigue, nausea, vomiting, diarrhea, and a sore throat. The nurse prepares to insert a peripheral venous catheter, PVC. Which of the following is an incorrect step in this process? A. Secure catheter with tape. B. Assess for infiltration or hematoma. C. Hold skin taut to stabilize vein. D. Explain procedure to patient and confirm identity. E. Insert catheter bevel down at a 15-degree angle. The answer is E. Insert catheter bevel down at a 15-degree angle. The catheter needle must be inserted bevel up at an angle between 10 to 30 degrees. The correct steps for inserting a peripheral venous catheter, PVC, are 1. Explain procedure and check identity. 2. Prepare equipment at the bedside on clean surface. 3. Apply appropriate personal protective equipment as needed. 4. Distend veins by applying tourniquet 4 to 6 inches above site. 5. Clean site with facility-approved cleaning solution. 6. Hold skin taut to stabilize vein. 7. Insert catheter bevel up at an angle between 10 and 30 degrees. 8. Pierce skin and vessel to enter vein. 9. Advance catheter until blood return observed, then remove tourniquet. 10. Withdraw needle from catheter and advance catheter to hub. 11. Secure catheter with tape or facility-approved dressing. 12. Attach forward tubing and begin infusion. 13. Assess for complications including infiltration or hematoma. The surgical nurse cares for a patient status post-umbilical herniorrhaphy. Which of the following nursing interventions is a priority for the nurse? A. Avoid coughing. B. Preventing overexertion. C. Relieve urinary retention. D. Provide ice packs. E. Turn and deep breathe. The answer is E. Avoid coughing. All of these are important nursing interventions for a post-op herniorrhaphy patient. The priority is to prevent increasing intra-abdominal pressure. Relieving urinary retention and avoiding coughing are the most important considerations to achieve this priority, but it is most important for the nurse to remember to avoid coughing, as it is most likely to increase intra-abdominal pressure. It is also important to remember because it is often promoted for other post-operative procedures, and this is one case where it is not. The community health nurse educates a group of young boys who are learning about hiking safety. Which of the following statements made by the nurse is not effective for preventing Lyme disease? A. You should be aware of where ticks infected with Lyme disease are located, particularly in the upper Midwest, New England, and the Mid-Atlantic region. B. You can take antibiotic medications before hiking to make sure you don't get Lyme disease. C. You should wear insect repellent on your skin and clothes if you are in an area endemic to Lyme disease. D. Try to cover as much of your skin as possible, long pants, long sleeves, long socks, and cover your neck and hands too. E. After you hike in a Lyme disease endemic area, carefully examine your skin for ticks. The answer is B. You can take antibiotic medications before hiking to make sure you don't get Lyme disease. Prophylactic antibiotics are not indicated for the prevention of Lyme disease. Antibiotics will be used after a tick bite when symptoms develop and an infection is suspected. The community health nurse should teach rules of prevention, including 1. Knowing where Lyme disease is prevalent, New England, Upper Midwest, Mid-Atlantic states. 2. Wearing long sleeves and long pants, covering as much skin as possible with clothing. 3. Using insect repellents such as sprays over the whole body, and 4. Checking for tick bites especially after exposure is anticipated, so you may receive care as quickly as possible if needed. Which of the following should be restricted in a patient with end-stage renal failure? A. Fluids. B. Protein. C. Potassium. D. All of these are correct. The answer is D. All of these are correct. A patient with end-stage renal failure should be kept on a low-protein, low-potassium diet. Fluid restriction is also an important part of management of patients with end-stage renal failure and patients on dialysis. A 75-year-old female with end-stage renal failure asks her nurse for advice about her diet. Knowing that this patient must adhere to a low-potassium diet, the nurse cautions her against which of the following foods? A. Eggplant. B. Cherries. C. Orange juice. D. Apples. The answer is C. Orange juice. Orange juice is very high in potassium. 1 12 ounces glass of orange juice contains 705 milligrams of potassium. This could easily increase blood potassium to dangerous levels. The other fruits and vegetables listed are all low potassium foods suitable for consumption by individuals needing to follow a low potassium diet. A nurse is looking over a basic metabolic panel for a 69-year-old male. She notices that his bun is 12 milligrams per deciliter. This value is dash. A. Normal. B. Depressed. C. Borderline elevated. D. Elevated. The answer is A. Normal. BUN, or blood urea nitrogen, is a measurement of the kidney's ability to excrete urea, which is a byproduct of protein metabolism. This patient's BUN is within normal range. The reference range for BUN is 7 to 20 milligrams per deciliter. You are the nurse taking care of an elderly patient with severe dementia and limited mobility who is at a high risk for developing a pressure ulcer. Which of the following options is the best first-line approach to preventing development of a pressure ulcer in this patient? A. Turning the patient multiple times per day. B. Applying topical antibiotic ointment to cover the patient's entire body surface. C. Administering broad-spectrum intravenous antibiotics. D. Request a dermatology consult. E. Administer a one-time dose of broad-spectrum intramuscular antibiotics. The answer is A. Turning the patient multiple times per day. In the preventive stage for pressure ulcer management, there is no need to perform any invasive procedures, administer antibiotics in a patient who may be at high risk for needing broad-spectrum antibiotics in the future, hence fostering antibiotic resistance, or consult subspecialty services, as there is no dermatological condition to be treated at the moment. The best option to prevent a pressure ulcer in a patient who is at high risk for developing a pressure ulcer is to turn the patient regularly while they are in bed, if they are bedbound. By turning the patient, the high pressure areas that would be at the highest risk for development of a pressure ulcer are able to have relief from pressure for a greater proportion of the day, night, and as such, can have blood flow restored while the patient is turned. By allowing for maximal blood flow to these regions, the risk of ischemia and subsequent infection and/or ulcer development is decreased. Without the actual development of an ulcer or infection, administering antibiotics, either topically, intramuscularly, or intravenously is inappropriate.